How do Americans navigate European healthcare systems? If you are an American thinking about moving to Europe, you might be wondering how to handle healthcare. The systems here are quite different from what you might be used to in the United States. Most European countries offer universal or nearly universal healthcare funded by taxes or social security contributions. Understanding how to navigate these systems is essential for a smooth transition. First, you need to know about residency and health coverage eligibility. In many countries, access to public health care is linked to your residency status. For instance, in France, you can access public health care after 3 months of residency. This is through the Protection Universelle Maladie program. In Germany, you must show proof of health insurance to get a residency permit. You can choose between public and private insurance there. Spain also allows access to public health care if you contribute to Social Security. Researching the specific requirements of your destination is key to knowing when and how you can access health care. Next, obtaining health insurance coverage is crucial. While public health care is generally affordable, you will likely need health insurance to comply with local laws and ensure you have access to care, especially during your initial residency period. Many expats opt for private health insurance plans, either temporarily or permanently. International insurers like GeoBlue, Bupa Global, and Cigna International offer plans tailored for Americans living abroad. These plans often include worldwide coverage and benefits for pre-existing conditions. If you gain residency and citizenship in an European Union country, the European Health Insurance Card can provide emergency medical coverage while traveling in participating countries. However, this card is typically not available to non-European Union citizens, so do not rely solely on it unless you have citizenship or permanent residency in an European Union member state. It is also important to plan for differences in healthcare delivery. European systems focus on equal access and cost control, which often leads to lower out-of-pocket expenses compared to the United States. However, some countries may have waiting times for certain treatments or requiring referrals from primary care doctors to see specialists. Familiarizing yourself with how to access care is essential. Registering with a local general practitioner or family doctor is common in many countries. Consider private insurance for additional benefits and flexibility. Private insurance can provide faster access to specialists and private hospital rooms. Many Americans choose private plans to complement public health care or to maintain continuity of care, especially if they have ongoing medical needs. Lastly, be prepared for administrative requirements. Navigating health care in Europe often involves paperwork, such as registering with local health authorities and obtaining a health insurance card. Keeping your documentation organized and seeking assistance from relocation services or expat groups can be very helpful. In summary, securing appropriate health insurance based on your residency status and healthcare needs is essential. Researching country-specific healthcare rules and understanding how to access care locally will help you navigate European healthcare systems effectively. This knowledge is vital when planning your European relocation and choosing your destination, as healthcare access and quality are significant factors in deciding where to live, work, or retire in Europe.